Hello, I'm Dr. Jeffrey DeSarbo, and I wanted to just briefly discuss how understanding biology can help patients and family understand an eating disorder a little bit better and help them cope with some difficult situations. Oftentimes, I'll have a patient come into my room, and it's not uncommon when people have a condition such as anorexia nervosa, and they're very underweight and malnutrition, and they'll say, I feel huge, and when I look in the mirror, I just see someone who's gigantic and obese. And oftentimes the family and people who don't know them look at them and they're kind of like mystified, like, what's going on here? Is the patient just making this up, or they're just exaggerating? This leads to the patient feeling very misunderstood and isolated with their feelings and the stress that they go through. Well, there was a study that was done that showed how people with anorexia nervosa, when they were put under a PET scan to actually look at the brain, it showed how they often had increased blood flow to the temporal regions here on the sides of the brain. And that blood flow pattern kind of resembled what you often see in states of psychosis and delusional disorders. Now, I'm always telling my patients, they're not psychotic, they're not schizophrenic, they're not even delusional per se, but there is a delusional type of perception that goes on, obviously, when somebody who can be, for instance, 75, 80 pounds is seeing themselves as obese. But again, this is something that often can be explained and accounted for by some basic biology. The patients usually do not know that, they're not aware of it, nor is the family aware of these types of things that actually take place in the brain. And these findings of increased blood flow is different from what you find in healthy control people that are out there. So oftentimes, helping patients understand this helps them understand that they're not making things up, that what they see is their reality. And I have to let the patients know that that is their reality, even though it may not be the true reality. And it's the same for the family, that again, they're not being melodramatic. This is what they see, this is what they're experiencing, and all the distress that goes with it. So this type of demystifying process can often help them understand and cope with and do the type of work they need to do in their recovery to get through their eating disorder. Unfortunately, changes such as this can sometimes persist for 2 to 3 years even after a patient is in remission with their basic eating disorder patterns and behaviors. The brain has to kind of go back to its baseline, and that sometimes takes several years to happen, sometimes less. But unfortunately, like things with body image, it's one of the most distressing things and is often the last thing to get better. Still, by understanding it's a biological process, it often helps patients and families be a little more patient and tolerant with this type of perception that they're dealing with. So again, I just wanted to give you that basic background, just a simple study and how it's used to help people understand better what's going on with their eating disorder and their body perception. Again, I'm Dr. Jeffrey DeSarbo from ED 180. Thanks.